Good evening, everyone. We have a wonderful guest with us today. I'm very happy and honored to welcome Miss Swandha Majumdar. She's a senior physiotherapist with 17
years.
of clinical experience, especially in neck, back pain, and movement-related problem. She has studied from some of the best medical college in Mumbai, including LTM Medical College in Science and Chem Hospital. Currently, she is working in Saifee Hospital, Mumbai, and she is also running her own center called Futuristic Physio and Wellness Hub. She has unique approach because she combines modern physiotherapy with yoga and movement therapy, which is very helpful for long-term recovery. We are really grateful she is here with us today. Please welcome Miss Swandha Majumdar. Yes. Yeah. All right. So, Swandarji, I just directly come to the question Q&A only to you. I'll ask you. Okay,
Sure.
it's related the neck and all I have already shared to you. Yeah. So my first question is with you is you have 17 years of experience. What is the most common neck problem you have seen today?
So the most common neck problem which I see is mostly after doing certain exercises or lifting weights. Suddenly they're not able to turn their neck to one side, spasm around this upper shoulder area. So mostly after lifting weights, and of course, been on a mobile for a longer time. This is the most common on the computer because everything because of the advanced technology. Every work is on your laptop or on mobile. So everyone is bending down and looking for so many hours, might be 8 hours, and this causes a lot of neck issue, and they're not able to turn their neck or look up because they're looking down for so long.
Absolutely. Very, very insightful actually. People are just watching down, not watching here and there.
And not
Right.
either looking up also, so they are mostly looking down.
Yeah, yeah, absolutely. Very insightful. Correct. So here, the next question comes. Can you explain neck pain is very simple language? What exactly goes wrong in inside?
Okay, so there are various reasons for different types. So there are neck pains of different time. One is like due to disc related. So between your two vertebra, there is a intervertebral disc. So sometimes you get people get neck pain because of the disc involvement. Next, the possible case is because of the nerve impingement. Third is
Hmm.
more of with a degenerative case after around 50 or 60-year-old people start getting that cervical spondylosis, which is the most common diagnosis we get it. So that is one of the
Yeah.
cause of getting the neck pain. So there are many different reasons. And other is mostly the spasm they get because, as I said, lifting weights. Now
Hmm.
exercise has become so much important. So people going to the gym, doing, and sometimes they do on your own, looking at the YouTube or whatever coming on the Instagram reels, and sometimes they
Hmm.
really mess up their neck area by lifting weights. I have seen people getting neck pain related, even doing a kettlebell exercises where they are lifting like 4 kg or 8 kg, like from 4 kg of
Hmm.
kettlebell exercise directly they shift to the 8 kg. A sudden
Ah.
increase of 4 kg and lifting it up higher, it injures the shoulder sometimes and neck if the weight is too much. So there are
Absolutely.
many different reasons to get neck pain, and depends upon different age group. Younger age group we get more of intervertebral disc, which I was saying. uh, in younger age we get that we call as a prolapse intervertebral disc at the neck also. How we had the low back
Okay.
area, we get at the neck area. So in younger age group we'll get
Okay.
that. In an older age group we'll get around as I said, nerve impingement. You start killing, you मुझे मूंगी आता है हाथ में, सुन होता है. So that you can see in
Hmm.
an older age group. So there are
Okay.
many things depending upon what's your occupation, age, what any history of trauma or history of lifting weights, all give you a different cause for the neck pain. So we have to
Okay.
see the person is coming to you at a young age group. Okay, looking
Hmm.
on the phone for a longer time. Occupation is
Hmm.
like this, and
Right.
then what is the disc related pain? interverted disc.
Correct.
So if your people in the older age group, might be a 60-year-old, and it's because of their posture, because of the hump, so all pressure comes. So then we have called as a facetal joint. So between your spine at the center, we have joints,
Mm-hmm.
the facetal joint. So in older age group, you'll
Okay.
get the facetal joint pain. From there, you get a nerve impingement, and people start getting
Mm.
pain in their hands, numbness, they have weakness in
Okay.
their hands. So depends on that. There's
Right.
so many things happening when you get neck pain. So my message is for like, when do you Google it, or you do a YouTube, or you search in Instagram, what do I should do for the neck
Mm-hmm.
pain? So they will give varieties of exercises. So because
Exercise.
and you don't know what is your diagnosis, okay, and you will say, okay, I should do this. This should help you. So that's why
Mm.
you need a proper guidance. What exactly you need to know your diagnosis, whether it's
Correct.
because of the intervertebral disc, or because of the
Mm.
facet area, or because of the postural, you're having a
Mm.
neck pain. So we need to know
Mm.
what is causing your neck pain and target
Correct.
that cause, and then you will
Mm.
be relief of the neck pain. So that will be a good way of treating your neck pain.
Absolutely. Yeah, and you need to analyze yourself, like which problem you are facing. That exercise which you are doing, that is for general, like
Generally,
most of the
yeah.
people, most of the people face. Yeah, correct. So here my third question, can you explain neck pain is a very simple language, like what actual goes wrong inside? This is like similar, like just now you said, but still you can, okay, I think this question I've already taken. I've just jumped into third question. I'll just edit this part then. Yeah. Why does neck pain keep coming back after physiotherapies or yoga or exercise?
Okay. So as I said, if you don't treat the cause, it will keep coming. Okay. For example, I got a neck pain, and my I have pain somewhere here. And what I did, the cause for my neck pain was my back posture. Okay, it was
Hmm.
something of hump which I have. My posture is
Hmm.
not good, or I'm just again doing the same thing. I'm not following the proper ergonomics. Okay, and apply some
Hmm.
ointment or something. I just did exercises which I saw on Instagram or YouTube, and I did all that
Absolutely.
exercises. But again, I'm like this. Okay, so
Hmm.
you have
Hmm.
not find out what was the cause because of your prolonged posture, which is like this.
A-
You're not following your
Absolutely.
ergonomic principles, like you have to take breaks in between. So you're not supposed to sit in a posture for a more than a 45 minutes. Okay, unless you're
Hmm.
doing an endurance training, then you can sit for 45 minutes. Otherwise, 30, at 45 minutes, you have to take
Hmm.
a break. Other thing, one is the reason because you're not treated the cause. Okay, that's why the neck
Hmm.
pain keeps coming. The second thing is you have not. So for any, for example, when my work is on a computer, okay, you're not
Right.
aligned your screen at this height, at the screen level of the eye, and you are like
Eye
this.
level.
Okay, it is
Hmm.
going to keep coming. Okay, then people will
Absolutely.
say, but I mean, this posture was so long, why suddenly I'm getting it? Okay, sometimes, someday your tissue is going to break down. It's a, yeah, this is my
Absolutely.
limit. Okay, you have been doing like this for so many years, now I can't do it. So you have to see that your alignment of your neck is proper when you are on a compute, working on a computer or on the
Hmm.
mobile. So see that the screen is at your eye level. So that ergonomic you have
Correct.
to follow. Okay, if you don't follow that, the neck pain will keep coming. Okay. Third is,
Absolutely.
uh, again, if the cause is because the posture, you need a postural endurance muscle training, which we don't do. We What we do is does this. So this is not
Hmm.
endurance training. So endurance training is working on your specific core muscle of your neck,
Hmm.
muscle of your scapular area, the shoulder blades. For example, your neck is aligned on your shoulder blade. Okay, if they are not
Correct.
strong, the neck is going to fall like this. Okay, it will not be strong enough to hold
Hmm.
it up. So this base has to be strong. So we need to work on your scapular muscles. So when they
Right.
are strong, your neck can be aligned properly. Okay.
Hmm.
So the thing, you have not work on your scapular muscles, you not work on your endurance of your cervical muscles. Have you
Right.
heard of anyone going through a training of neck core muscles. We all know core muscles of your low back area. Have you heard of doing a
Yeah.
core exercise for your neck? So
Not.
physiotherapists are aware, but not everyone is aware of it. We have core muscles of
Hmm.
every joint. So every
Every
joint has
joint.
a very important key muscle which helps you to stabilize your spine. So let it be
Hmm.
shoulder, elbow, hip, knee, back. Everyone has a core muscles. So the neck has a core muscle, so we need to work on that core muscle. So I am sure that hardly anyone is going through all that training. They'll end up just taking some of the temporary treatment and they feel relief for a few days. But
Absolutely.
again some point again it comes back. So you must have seen people get, oh, I've been having neck pain since last 7 8 years. It keeps coming once or twice in a year when I travel, when I
Hmm.
lift weight. Okay, so whenever there's a triggering factor like lifting weight and everything, it keeps
Hmm.
coming. Okay, so what is our aim? So that once you get the neck pain, you treat the cause, treat the
Hmm.
target muscle, work on the
Absolutely.
ergonomic principles, and see that doesn't come back. Okay, someday if you do some, there is an accident, something, and they got a jerk, that's a different story, but it should not come back again with
Hmm.
your work because you're going to work for a long, many years. Okay, so you have to keep
Correct.
work. So it's like, I'm just adding one more thing. For example, a weightlifter, he wants to perform at Olympics, so he will do that weightlifting exercises.
Heavyweight.
But
Yeah.
those who are working for the desktop people who are working on, but have they trained their neck endurance, back endurance? No, you don't
No.
train according to your occupations, right? That's सबको
Hmm.
करना है, but no, you have to train according to what your occupation requires. Your occupation requires to sit for a longer time, so you need to work on
Hmm.
neck endurance, scapular endurance, back endurance that way.
Hmm. You have to train what your body demands,
Mm.
your activity demands.
Correct.
Abs- That's really nice. That's really very insightful that actually you said. Like people who work staying in corporate world and dreaming for Olympia exercise. My God.
So what they do, corporate work, they go to the gym, they do weightlifting,
Ah,
so they do strength
ah,
training, but they're hardly doing working on their endurance training.
absolutely, absolutely.
Okay.
Correct, correct. And so, why do people feel pain or numbness in the shoulder, arms, finger because of the neck pain? This is mostly.
Yeah, I answered that. So when you get tingling, numbness, the mostly it's a nerve related pain. And as I said,
Yeah.
in a younger age group, it's a prolapse intervertebral disc because the disc is protruding out. So it impinges on the nerve, and that's why you get
Hmm.
pain. In old age people, it's because of the joints becoming, the space between the two vertebrae decreases. So there is hardly any
Hmm.
space for the nerve to go, and that's why you get a degenerative spine. We call it the cervical
Hmm.
spondylosis, and because of that, you get the radiating pain. There are other reasons when your nerve becomes, we call as a nerve becomes tighter. It's like a, its mobility of your nerve becomes less. So to improve the
Okay.
nerve mobility, we give a neurodynamic mobilization. Neuro
Okay.
is nerve, dynamic is the movement, and mobilization, we mobilize it in certain way that you should not stretch that nerve because nerve is very sensitive. If you stretch, it will become more irritated and it will increase the symptoms.
Hmm.
So you have to stretch in certain way that it improves the mobility, but it will not get irritated. How you have heard of sciatic nerve in the lower
Hmm.
body, when
Yeah.
you get in the upper body, you have median nerve tissue mobility
Yeah.
impaired. You have ulnar nerve, you have radial nerve. So when you get tingling numbness, this is the three main nerves which gets affected. So median nerve, ulnar nerve, and radial nerve. So we physiotherapists evaluate which of the, when anyone complain of the nerve tingling and numbness, we see that if any of this nerve is mobility is impaired. That's one
Hmm.
important thing is there are we physiotherapists also know when we have to give physiotherapy and when you have to refer to an orthopedic doctor, because
Hmm.
there are some where you can handle, but there are some which is like a red flag. For example, people complaining of, I have fever, I don't I have loss of appetite, weight loss, and there is some
Hmm.
swelling. So you know there's some red flag, there is some systemic cause, and then there is a weakness in the hand. Okay, so we need to
Okay.
find out, is it a red flag or what? So we need to refer to a particular disciplinary doctor, an orthopedic, to go for more investigation, go for an X-ray, an MRI to find out if there is systemic cause which is causing. So we, if
Hmm.
you have heard of Cox spine, we call it tuberculosis of spine. So,
Okay.
so we get that affection in any of the region. It can be at neck, thoracic, lumbar. Okay. So when you
Hmm.
find any person having all these symptoms, so we know what we have to see for the red flag. Okay. And then if it is, then
Hmm.
you have to refer it. So it's not necessary सबको neck pain है. Okay. Need to evaluate what it is. Okay. So there are other
Right.
systemic cause also which can give you. So I'm seeing a other like tumor around the spinal cord, so need to know if there
Yeah.
is certain more weakness with the sudden onset of weakness, what it is. So somewhere you everything can't no, okay, just neck movement is exercise. No, we need to diagnose it. Okay, we need to
Hmm.
know where to refer to the doctor when this is when the red flags are there.
Hmm.
Okay.
Hmm.
So when as you talked about what you, why you get pain and numbness, so it's a nerve involvement. Sometimes there's a systemic
Right.
involvement, it's a cox spine or there's a spinal cord tumor. So we need to see all that.
Okay. Okay. Yeah, absolutely. You have to see like the cause of analyze and that way and you have to always go to a person like who can take care of that, then only it will help you, otherwise like doing by self it won't help you.
Yes.
Absolutely, absolutely. So now here, so this year I've already said about this question which I said, but if you still feel anything to discuss about that question, you can tell me. Many desk worker exercise regularly but still have pain. This year I've
Yeah.
already covered, but why actually?
So as I said, you
Uh,
they will normally work on the, so they will go to the gym. Okay, they will work on their
uh,
strength training. They will all do this, but they are not working on the endurance training. So I'm doing a lot of weightlifting and everything, and at workplace I'm like this. Okay, so
Absolutely.
ergonomic principles, work on your target. So I would, it is always better. For example, we work for that we work as a preventive measures also. So you
Hmm.
can go to a therapist. You can make yourself evaluate your posture, and you can find out which muscle. See, I'm not be a perfect. Some muscle might be weak, so I need to know what is weak, what I have to train, and then you
Hmm.
can do the training. So I'm going to go
Okay.
for a work which is going to require to sit for longer time. So what muscle have to get strengthened? Okay, how's my
Ah.
posture? What I should work on my posture to improve the posture. Everyone will not have a good posture. Somehow, something will be there. Someone will be having a protracted shoulder. Someone will be having a big hump, low back. Is you
Hmm.
need to analyze your posture, get yourself
Hmm.
evaluated. It's just a 1 day
Right.
assessment. Do your assessment,
Okay.
find your which muscle is weak, what you have to train, do that training,
Hmm.
follow the ergonomic principles, and hope you will not get the neck pain.
Absolutely, absolutely. So, is there any which place person can go to check their anatomical position? Is their posture is upright? Which muscle is not working, or which
So
muscle need to
anyone,
be
any
trained
the physiotherapist can evaluate the posture from top to bottom. Yeah,
top to
what is
bottom?
it? So they will evaluate it. They'll see how is your scapular level. They will see. They will do a certain special test and everything, and they will find
Hmm.
out. You have to tell what is your what you are come for. You want it for your assessment, and you want to know like my work is this, what I should work on that. So they will give you
Hmm.
proper training, and you can add that whatever the therapist guide, you can add in your gym, whatever wherever you can in your daily routine. As we all know,
Hmm.
key exercise is very important. It's just not I'm doing exercise to because I have a pain. Even if I don't have pain, you should do exercises. Importance exercise, I guess everyone knows it. It keeps you moving ahead. You can be mobile. You can walk for a longer time. You can run. You can do your sports activity. Everything. So exercise is
Hmm.
very important. And if you add on this specific to your requirement, it will
Hmm.
be beneficial for you. For
Absolutely.
example, like there's one person, she wants to ride a bike. Okay,
Hmm.
but there is
Hmm.
certain aches and pain. So, what is required to ride a bike? What you need of your core
Arm
muscles, your
strength.
shoulder muscles?
Hmm.
Work on that
Hmm.
muscles. Okay,
Yeah, absolutely.
that's
Correct, correct, correct. So here is my next question. Like it's related to your stream, yoga therapist and physiotherapist. So you are trained in both physiotherapist and yoga therapy. How do this works together for neck pain, physiotherapist and this yoga?
so. I'm a Pilates instructor, also. I'm a yoga instructor, and I'm a physiotherapy and a movement therapist. So I apply all the things combined towards in treating a patient. So, as you all know, most of your neck pain, there are many factors, as I said. Stress again come to one of the factors. Have you ever
Hmm.
experienced I'm stressed and you will feel little discomfort, you'll feel some stress here. Okay, if you read stress, when there's an increased stress, your neck and back gets affected. So stress is one of the
Hmm.
important cause. And as we know, yoga is a it's yoga, not yoga. It's yoga is a union of mind and body. Okay, the alignment. Okay,
Absolutely.
so if and stress is what there are so many thoughts coming. I have to do this. Those so many thoughts coming. Okay, so having your presence of mind, whatever you're doing activity. Okay, so
Hmm.
having not many thoughts at a time. Okay, so yoga you apply in like your so I add pranayam also. I give breathing exercises, pranayam breathing exercises. When I understand, when you evaluate, there's a lot of stress factor which is also there, which is causing contributing to neck pain. So adding
Hmm.
pranayam in one of the exercise routine, then breathing technique in doing exercises, then, of
Right.
course, the posture, the movement therapy. I'm a movement therapist, is a kinetic control. So, for example, I'm giving one movement. So, a person coming and saying, I do this and I get a neck pain. Okay, I'll show you a side.
Hmm. Yeah.
So, the person saying, when I look up like this, I get a neck pain. So, what the person is
Right.
doing, it's just moving from only one joint. You are just
Right.
hooking to the one joint. That's a good pain. So, the movement therapy, what it is, I see what how ideally you have to look up. So, you have to when you move your neck, you move from your all the joints, just not from one joint.
Hmm.
Okay. Sometimes you
Yeah.
forget when you have a neck pain, your body forgets how to move in a proper manner. You get used to
Hmm.
that alignment. So when you move your neck, so you go from your upper one, the mid one, and the lower one. So see your range is more.
All
And
all the
otherwise, you are
seven.
like this. Okay.
Hmm.
And your posture is also. So movement therapy is how to move pain free. What is the
Hmm.
correct way of moving it? Because we all are moving now proper, but when you are pain, we forget how to move properly. So that
Absolutely correct.
re-education of the movement, how the neck has to be moved, even for rotation of the neck. So people will do like this.
Yeah.
Okay, they're moving
Absolutely.
in
I've
this
seen.
alignment. Otherwise, they will look like this. So how to move your neck also? It is otherwise in subconscious. When I want to look, I'm looking like this. But when you have pain, something you will do is you will do something weird thing, and it will
Yeah.
create more pain. And then they will say, whenever I look, I have a pain, but you're moving wrong.
Correct. Absolutely. I
Okay.
agree.
So we have to. So what we movement therapists do, we see how you are moving, and
Hmm.
you we align, and we see that your movement has to be proper. And then once you do that movement therapy for a
Hmm.
regular period, every day, twice a week, the research says when you do a twice a week that movement therapy exercises for a 6 weeks regularly without leaving
Yeah.
Sunday,
Yeah.
your body, your brain will get adapt to that movement, and you don't have to remember every time, okay, I have to move like this or what the way subconsciously. For example, when you're walking, your arm swings. Okay, you don't have to tell you have
Yeah.
to swing your arm, but there will people they will not swing their arms while walking. We have to tell them, yeah, move your arms slightly. But why moving our arms are required? So it is energy distribution. So if you're not
Weight
moving, there is no
distribution.
energy distribution. The
Right.
thoracic has to rotate, so that's why the arms has to move.
Ah. Oh.
God has made
Okay.
so movements so properly. We are not aware. If you go in detail, there are so many things which is we are moving in certain way, there is certain reason for it.
Absolutely. That is actually a very amazing thing actually shared. And I have seen when I teach people, so they don't know how to do chin tuck. They just move their body. They don't know. They only know this moment or maybe this moment, but they don't know even this moment. Yeah, very rightly said. Because when they do wrong movement, it affect wrong muscles, and it
Yeah. So they just
create a
move
huge
only
problem.
one joint. They just move from one joint, and they know they have to move from this area also. They'll just stretch in one area, and they will say, "Oh, I can't
Ah,
move. I can bend from here also. No, I'm better." So we need to make them aware what actual movement is.
absolutely, that's very insightful actually. So this is the last question because you have covered most of my questions. So I just come to the last question now.
Sure, sure.
What one message would you give people who are suffering with the neck pain?
So, one message: get yourself diagnosed properly. Okay, and whatever exercise has been given for your core or scapula, do it. What is the most thing I have seen? I went to a therapist, I went to yoga therapist, I did for it better, but it came back after 2 3 months. Okay, that's the most recurrence
Yeah.
of the neck pain. You have to continue that exercise for at least for 2 months, around 8 weeks.
Hmm.
Okay, or 12 weeks, 3 months. Okay, continue that. People leave it halfway and then say my neck pain it went away but came back again because you left it. For muscle to get
Hmm.
strength and to up, I told you 6 weeks at least it's required. Okay, to
Hmm.
adapt, and then little more weaker if you add, and it will help you more to retain it. So the main
Correct.
important thing is I always tell my patients, please continue the exercises. You don't have to come to
Consistency.
me, but please continue. But there are again, like how in gym after 5 kg we go to 6 and 8 kg. So of course there is little advanced exercises also. So you have to just visit. You don't have to go every time. Visit once
Hmm.
after you are done. Visit for the little advanced exercises. Do it. Follow up is very important, which is not there. That's why they keep getting the neck pain. So
Hmm.
go to progressive, and my work requires sitting on a computer, so it is going to be nice. So do the endurance training. That's one message is
Absolutely.
if you have, please continue the exercises. And once that exercise, it's easier and not to go to an advanced. So just go to the advanced training, how you go to the gym and keep increasing your weight. That's where you have to improve the exercise. And once you have reached the highest level, just maintain that.
Absolutely. Yeah. Very insightful session. Actually, I've learned a lot of things. Also, I understood like where actually people make mistake, and this interview will be a most valuable for people and audience. If you are watching this video, just what you have liked three thing from Dr. Swandha, type it will be a most valuable because I have learned a lot of things and I feel like I have to keep taking interview with ma'am, and she did a wonderful job, and I want to learn more things from you whenever you going to keep a workshop, whenever you will be there. If you will call me, I would love to come, love to learn more of most of the thing you have given. That is very good thing. I will implement whatever thing you have given. I will tell my student also to implement. It was a wonderful having you. I will be having more interview with you such way. It was fantastic having you here. Yes.
Thank
See
you.
you for the, yeah, see you for the next interview where soon we will be having with interview.